In rural India, primary health centers, PHCs, and sub-health centers, SHCs, play a major role in providing last-mile medical services such as immunization, child deliveries, and neonatal care, all of which cannot be delivered without regular electricity supply. There are approximately 25,000 PHCs and 155,000 SHCs in rural India as of 2020. Among them, 4.3% of the PHCs and 28.4% of the SHCs in India do not have access to electricity. Solarizing PHCs can significantly improve last mile access to quality healthcare services. Let's hear more from Kristina Skierka, CEO Power for All. Welcome, Ms. Skierka.
Hello, my name is Kristina Skierka. I'm founder and CEO of Power for All. Power for All is a global initiative of over 300 partners around the world, including several in India, that's dedicating to ending energy poverty faster. So first, what we're going to cover in our presentation today is a little bit about the vision and the hope of ending energy poverty faster with decentralized renewable energy. It's a perfect fit for the Solar Congress today because a lot of this energy comes directly from the sun. In addition, we want to talk about a specific use case for solar as it relates to health in India and the particular fit and benefit of using decentralized renewable energy to help with the healthcare system and give you some great inspiration of how some of this is working right now in the state of Jharkhand. So a bit about the vision of Power for All. So Power for All believes that everybody has the right and the opportunity to enjoy all of the benefits and choices that come with access to energy. Yet today, there's 1 billion people throughout the world that don't have any access to energy, and around another billion that only have intermittent access. You put those two things together and you have a serious limitation on people being able to realize the full opportunity of their lives. Well, the great news is that the vast majority of those without energy live in rural areas, which is a perfect fit for a decentralized renewable energy solution, which we'll be talking about later in our presentation. So a bit about energy. Look, this is a very particular audience here as part of the Solar Congress organized by the Economic Times. But most people don't really understand energy, but they do understand the benefits of access to it. That ranges from having the ability to power their lives and enjoy the opportunity to create new businesses, to study after dark sometimes, and just to be connected through the internet. So it's really not about focusing on the electrons for people, but rather what the electrons can do for their lives. In particular, we take a lot of inspiration from how mobile phones took over the continent of Africa and almost overnight changed people's lives. So what happened in those early days, in the early 2000s, when mobile phones first came on the market, they were very expensive, they were heavy, and it was very unavailable to many people in the sector. However, things changed once 3 specific factors occurred. One, there was suddenly competition as more and more private companies began to compete for people's dollars or shillings throughout the world. And in addition, there was also a growth of more affordable cost of goods. And then finally, the advent of pay-as-you-go, or being able to pay for energy services, mobile services in this case, in bite-sized chunks, opened up the use of mobile phones to millions. So the great news is decentralized renewable energies such as rooftop, mini grid, etc., those have the same competitive advantages that mobile phone had. And we expect that with the right enablers in place and the right collective opportunity, we will begin to see a similar hockey stick of growth. So a little bit about health. Look, the pandemic for the last 2 years has been unbelievably brutal on so many of us. It has taken a toll beyond measure that most of us ever expected. But if there is a silver lining to the pandemic, it's been that we've seen for sure how the health infrastructure really matters in the future of a country. And also through the work of Power for All and partners in India, we've seen how renewable energy can make a particular difference to these health outcomes. So just a little bit about health that most of us are already familiar with. But having reliable access, particularly in rural healthcare centers, is essential for changing people's lives. It means everything from being able to take care of children and newborns in off hours or the middle of the night, being able to refrigerate vaccines in this case, or even things like blood to ensure that we have access to the kind of cold storage that's necessary to support healthcare systems. In addition, the simple things that you would normally take for granted about being able to sterilize and power medical devices, but also to make life better for our frontline healthcare workers that we've heard so much about, the incredible toll that the lack of quality energy access has really affected the livelihood of those in the medical community. So at a glance, what we're seeing is that over 180,000 healthcare centers in rural areas in India don't have access. And in particular, there's insufficient access in 40,000 of these subcenters and another of the public healthcare centers. So altogether, we're looking at nearly a third of the healthcare centers that are in rural areas in India suffering from lack of adequate access. And the challenge of trying to operate without newborn care equipment, et cetera, is really causing an incredible challenge well beyond the pandemic. But the pandemic has created the opportunity to focus on what electrification can do for these healthcare centers. In the next slide, just a bit about the national budget and how we got here in terms of health. As per the National Health Policy of India in 2017, it was committed that India should spend at least 2.5% of its GDP on health to improve India's poor standings on various health indicators. So that was great to have that recognition, but even more emboldening is that in the recent budget, strong commitments were made towards universal access to healthcare through things such as the National Digital Health Mission. But even better is that more recently, the finance minister announced the beginning of an entirely new scheme that'll bring up to $8 billion spread over 6 years to help with health infrastructure. And in this year alone, the government would give states around $500 million to fund wellness centers, integrated public health labs, and critical care hospital blocks in some districts. So now in the next slide, let's start to focus on the unique opportunity that decentralized renewable energy can bring. Decentralized renewable energy offers fast, affordable, and sustainable health. So we all know that the healthcare system has been overstressed and that reliable power supply is just as important as access in the first place. And what we see in this slide is that for just 8 cents per person in India, solar can electrify almost 40,000 health subcenters, enabling better healthcare in communities, but also helping to integrate the health and energy sectors in a way that's never been done before. This will result in life-saving procedures and vital medical devices and appliances to really encourage health and facilities that can boost successful childbirth and ensure long-term healthy populations. Specific to decentralized renewables in India, so it's been a burgeoning sector for almost a decade. And what's great is that DRE can support the strong initiatives already led in the country to support 24/7 reliable energy supply. One example of how the government has begun to embrace decentralized renewable energy to support 24/7 is the Kusum scheme, which targeted in a very short amount of time a cumulative installed capacity of almost 2 million water pumps by 2024. Importantly, other things to keep in mind about what DRE can do for India includes what the expected market share of cold storage is going to be in the country and the overall global investment, meaning that venture capital and funding from donors and aid agencies around the world will grow this market into something that's equivalent of $18 billion by 2024. So now the question is how do we action on this promise and this opportunity? So let's talk a little bit about the work being done by Power for All and our partners in India. The impact that we're seeking is quite clear. We want to develop collaborations that institutionalize partnership between health and energy ministries and sectors across India. See, early in the pandemic, we investigated with our partners what exactly was happening. How did we get to a situation where we have this growing decentralized energy market and yet so many healthcare centers that weren't electrified? And what we found is there was this natural bifurcation between health and energy ministries, that in between the two, no one was directly responsible for ensuring and prioritizing the electrification of healthcare centers. Nobody's fault, and it's something that we've seen around the world, but this is why we have engaged in India specifically to do these following three things: to drive awareness of the energy gaps facing the rural healthcare centers, and to create lasting collaborations that actually create a nexus ecosystem between health and energy. Because as you've seen in the slide today, you have to have both in order to have an effective healthcare system. And then finally, to advance sustainable business models, including efficient equipment and systems capacity. So again, altogether, there thankfully is now a beautiful silver lining to what's been 2 years of suffering during the pandemic. So towards the end of 2020, Power for All with its partners, some of which you see here, all very well-known Indian institutions, launched a call to action after hosting a roundtable identifying this chasm that existed between health and energy ministries and pointing a way forward. And importantly, it's never been the approach to simply point fingers and identify problems, but rather this partnership is focused on identifying solutions. And what you see amongst these partners are a number of entities ranging from engineers to CSOs to ministries themselves that all are working together to help the government solve this problem. So as we launched a call to action to government to help prioritize electrification of healthcare centers, we promised we'd be there every step of the way to help. So as a great example of how to bring energy, in particular the solar sector, together to help support the goals of the country, we worked to identify and develop an action plan that is paving the way forward for 2022. Importantly, this boils down to about 4 specific points. So it's focusing on expanding clinic solarization, allocating dedicated capital or helping find capital to bring this electrification forward, also ensuring long-term operations, and finally promoting the kind of innovation that can help build markets in India, including support the manufacturing sector in creating even things like rugged appliances that can work in rural healthcare settings. And now in our last couple of slides, a deep dive that should give us all hope for the future of healthcare and renewable energy in India. So as a result of this call to action, there was a unique opportunity to create a partnership with the health ministry in Jharkhand. They became a partner and saw an opportunity early days with funds available from the state government that had been set aside to solarize government buildings. So this pandemic, again, focused a huge opportunity on health departments and rural healthcare centers. And by showing cracks in the system that people weren't necessarily as aware of before COVID-19, it also provided an opportunity to create a partnership to improve alignment with the public health standards. On the next slide, you'll see some very specific actions being taken as a result of this collaboration. So established in Jharkhand was a collective of over 50 partners across energy, health, and agriculture to reach all 24 districts. And together, we were working to develop a roadmap will help identify the way to roll out installations across the entire state, but it's working closely with Jareda and identifying opportunities of existing funds, which importantly, the DMF funds is a critical resource for solarizing healthcare centers. So for those who maybe aren't as familiar, DMF is a levy on mines and minerals produced through district governments to really improve and sort of offset the negative effects of mining in the state. And what's great news here is that that money can be used specifically to help solarize healthcare. And initially in these steps, we've got an initial target of 243 healthcare centers, but the goal with this rollout is to get even beyond that. It just shows you the power of partnership and the value of bringing the solar sector to work closely with the health sector. Altogether, let me just say that it's another reason to be grateful for this opportunity that the Economic Times has created to bring together all of the solar sector in India. See, decentralized renewable energy solutions can transform the way people all over the world can access and use power, and India is no exception. We are facing a unique moment in time, thanks to the pandemic, to really transform the face of universal access, including reliability across the country. It's important that we take away from this presentation and this incredible event put together by the ET, that we work together to drive acceptance of renewable, distributed power as a legitimate part of the energy supply and help end the energy poverty in the medical sector. Thank you so much.
Thank you, Ms. Skierka, for all the knowledge around solarizing healthcare infrastructure in India. Now let's move ahead. Stay tuned, everyone, and explore the expo area for all the useful information shared by our partners at their booths.